family as well. Thank you, Daniel. We will begin by giving honor and thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the lands where McMaster stands. To say that is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. On behalf of the COVID community study, the Population Health Research Institute, Hamilton Health Sciences, and McMaster University, thank you for joining us this evening, where we will share knowledge and converse on topics of interest regarding the COVID-19 pandemic and vaccines. My name is Sajani Kandasamy, and I, along with Jania Limbachia, will be the co-moderators for this evening's session. If you are indeed Twitter savvy and want to amplify your experience during the session, you can use the hashtag COVID-19 South Asian. If you are a participant in the COVID Community South Asian Study, we thank you for your active involvement in helping us learn more about immune response, immunogenicity, and vaccine confidence, access, and uptake in the South Asian community. As a reminder, once you complete your outstanding questions and dried blood spot sample collection, you will be sent a gift card as a token of appreciation.
All right, so then let's get started. We'll start off with doing some introductions of this all-star panel. So our first panelist here is Dr. Zane Chagla. Dr. Chagla is an associate professor in the Department of Medicine at McMaster University in Hamilton, Ontario, and he's an infectious disease physician who's involved with tropical and global health work. He's been involved in media and communications, infection control, outbreak management, and clinical trials for COVID-19. Please welcome Dr. Zane Chagla.
Hi, everyone.
Next, we have Dr. Gita Wahi, an associate professor of pediatrics in the Faculty of Health Sciences, McMaster University, and pediatrician at McMaster Children's Hospital. Her research focus areas include child health and health equity. She is also a member of the Townhall Research Center, which is part of the Faculty of Health Sciences at McMaster University. Welcome, Dr. Gita Wahi.
Next, we have Dr. Fahad Rasheed, who is an internist and epidemiologist with specialization in observational methods, big data projects, and global health. He often collaborates with researchers across many disciplines, such as economists, computer scientists, on research areas that require diverse expertise. He's also a current member of the Ontario Science Table. Please welcome Dr. Fahad Rasheed.
Hi, everyone.
And last but certainly not least on our panel, we have Dr. Sonja Anand. Dr. Anand is a professor in the Department of Medicine and the director of the Population Genomics Program at McMaster University. She is also a senior scientist at the Population Health Research Institute at Hamilton Health Sciences. Dr. Anand holds a Canada Research Chair in Ethnic Diversity and Cardiovascular Disease and the Heart and Stroke Foundation of Ontario, Michael G. DeGroot Chair in Population Health Research. Her current research focuses on environmental and genetic determinants of vascular disease in women and populations of varying ancestral origin. She is a principal investigator on the COVID community study, which is exploring vaccine confidence and immune response in the South Asian and First Nations communities. Please welcome Dr. Anand. All right, so without further ado, we'll get into the questions. We've had some submitted questions that we'd like to start off with. The very first one is for Dr. Chagla. Can you please explain the different types of immunity, why and who would require a COVID-19 booster shot?
Absolutely. So with as much as I can try to describe the immune system in less than a couple of minutes, our immune system is really broad, and it's a good thing, right? We've evolved to deal with pathogens over time. So we have immunity that is kind of working all the time, scavenger immunity, natural or an innate immunity, which is kind of at all of our barriers to try to attack things. But what really clears viruses out is our antibody immunity, and our T cell immunity. And those two work together essentially to adapt, to recognize pathogens, to get better, and clear them out, as well as develop memory for the next time we see them. And the whole point of our vaccines is to trigger that immunity right away, to get that immunity well developed. Because in a normal person, when they're exposed to something, it can take a few days, a week to develop that immunity properly. It can take even weeks and weeks and weeks after that for it to really mature and get really precise in that sense. And so, when you get vaccinated, you trick your body into being infected to a point, to seeing little bits of the virus in order to get that immune system triggered, and for us to start that process of developing that immunity so that when we actually do see the pathogen, we have a huge head start, that our immunity kind of sets in from day one. And for the most part, we protect ourselves from even getting infected. But even if we do get infected, becoming a so-called breakthrough infection, that immunity still protects us from getting very sick as the virus gets cleared out really, really quickly. Now, for the most part, people who've gotten their full series of vaccines have really, really good protection from getting sick. That immunity is there and robust for not ending up in hospital. And we've seen this around the world in multiple studies. And they have protection against getting COVID-19. It's not perfect, but there is protection from getting COVID-19, from transmitting COVID-19, and from acquiring COVID-19 from an exposure. We do know there are some people where their immune systems aren't perfect, and their B and T cells, from a number of reasons, their underlying health conditions, the medications they're on, if they have cancer or another immunosuppressive state, where their ability to mount a good B cell, T cell response to make antibodies isn't great because of their underlying conditions. And giving them a third dose of vaccine, along with their initial vaccine series, may help with kind of triggering that immune system a little bit more. We do know also in some populations, like the elderly, where their immune systems are good, but over time, the antibodies and the responses to the pathogen just get a little bit slower and slower. And that's a normal finding that we see with age, that the immune system doesn't necessarily trigger as much as a younger person's immune system. And so right now in Canada, the two major groups we're targeting for boosters are those individuals who are immunosuppressed, where a third dose, not even a booster dose, but a third dose at the time of their primary series may help with really generating some good immunity for some time. And those elderly populations, right now over the age of 70, although that may change, in order for them to derive a little bit more benefit from the vaccines, to get their antibodies up as they may slip down over time. And we do know that elderly group is the highest risk of complications out there. If people, who are elderly get vaccinated, absolutely, they're at much lower risk of being hospitalized and dying of COVID-19. But we do know that's also the most fragile group in terms of outcomes from COVID-19. And again, the point of the booster is just offering them more protection to really use their immune system properly in order to get the most protection from this virus.
Excellent. Thank you, Dr. Chagla. Our next question that we had submitted was for Dr. Wahi. So the question asks, why do children need the COVID-19 vaccine? How can I prepare my child for the COVID-19 vaccine? And how is the vaccine different for children 5 to 11 years old?
Okay, those are a lot of questions. And I think at the core of it is that we need to protect children and families. So the number one reason for children to get the COVID-19 vaccine is to protect them against illness. Fortunately, most children who are infected with COVID-19 have mild symptoms, but there are a group of children who've been hospitalized and some who've needed intensive care support. So I'm a pediatrician. I look after children who are admitted to hospital, and I've looked after children who have COVID-19 over the last year and a half. We cannot reliably predict which child will have mild disease compared to those who will be hospitalized. Therefore, it's important that we protect all children. Another reason is that after the illness with COVID-19, even if it's a mild illness, we've seen that some children go on to develop post-viral syndromes. So one of them is an inflammatory condition, and it's called MIS-C, or multisystem inflammatory syndrome. And this is a condition where children present with prolonged fever. They may have GI symptoms like nausea and vomiting, as well as heart or cardiac complications. All of those children have needed to be admitted to hospital for treatment. And that's something new and evolving that we're just learning about that has been seen after the COVID-19 virus. The other post-COVID syndrome that we've started to observe is something called long COVID. So children and adults, a small group of them, have had persistent syndromes, persistent symptoms, even after mild disease. And this is a condition that's still evolving and we're still learning more about. So between reducing the risk of hospitalization and post-COVID complications, and I think we have enough reasons for children to be protected. But I will add that, aside from that, children and families have had to endure considerable disruptions in their lives from the COVID-19 pandemic restrictions. But immunizing children, we will further reduce that risk. So children will be able to stay in school, they'll be able to continue social interactions, they'll be able to continue their extracurricular activities. And immunization, along with other public health measures, is another layer of protection to keep their lives going. We know that children being immunized will also help protect household members who may be at higher risk or too young to be immunized. And we know this is a safe and effective vaccine for children 5 and over. I think the next question was how this vaccine is different. So there are a couple of differences specifically for the 5 to 11-year-old age group. First thing is that this dose is smaller. When they did this study, they looked at 3 different doses and they found that that was 1/3, so 10 micrograms versus 30 micrograms, 1/3 the adult and older youth dose was appropriate for this age group. Also, the NACI, which is the National Advisory Committee on Immunizations, has recommended at least 8 weeks between the 2 doses. This is due to real-world observations that a longer dose or a longer interval between the first and the second dose will produce a stronger and longer immune response. I was in clinic today, I saw lots of patients and we talked a lot about the COVID-19 vaccine for the younger ones. One of the questions is what is the common side effects? In the Pfizer trial, they've had minor side effects, so things that you would imagine like a sore arm, for example, but no serious side effects were noted. And I think we have a lot of data already from the US. So they're a few weeks ahead of us. They've have almost, I think, 3 million children ages 5 to 11 have gotten their first vaccination and no major side effects have been reported. When we think about how you can prepare your child, I'd start off by saying that we know parents are the expert in their child and they know what's best. Children and parents have walked through many immunizations in the early years, and the COVID-19 vaccine, though there's a lot of anticipation around it, the preparation should be very similar. So thinking about ways your child will be comfortable during the vaccination, for example, wearing a short sleeve shirt, having your arm easily accessible for the vaccinator, perhaps bringing something that's a favorite toy or something that comforts them would be important. The next thing I do, I would empower your child to ask questions. When's it going to be my turn? What's going to happen? Which chair am I going to sit in? What's it going to look like? And talk about it, because I think the children need to be in control and be able to ask those questions. It would be good to perhaps beforehand, if your child's nervous, think about ways that may relax them. So taking deep breaths, maybe bringing ice with them to numb that area. A favorite toy again that keeps them calm. And then distraction. Distraction is key. And this is where you want to bring out technology maybe. And maybe they're going to watch a YouTube video, or they're going to see some pictures on your phone, or you're going to listen to music. Children and parents are, parents have done this and they can do it again. And there's a lot of anticipation and there's a lot of excitement that I think a lot of kids are excited about getting this vaccination. I think I answered all the questions, Jamie. Yeah.
Yes, you did. Thank you so much.
Thank you, Dr. Wahi. The next question is for you, Dr. Fahad. What are the recommendations for a long-term plan for pandemic recovery?
Thanks. So first of all, great to be here, and thank you to the organizers for inviting me. And I'll just say from a personal perspective, the first person I ever worked with in research was Sonia, and such a delight to be back on a panel like this with her. So really special for me. I'll answer the question in 2 parts. I'll talk about what I think are probably the critical steps that will get us through the pandemic, acknowledging that nobody knows when this is going to end. There's been lots of curveballs along the way, and I think we have to be humble about expectations and predictions as we go forward. So I'll say that from the science table, which I'm a member of, we've kind of looked through reviews of different evidence bases for what is probably most protective for the public. And the first is continuing public health measures like restricting entry to dense crowded spaces only to people who have vaccines or fully vaccinated, enhancing ventilation and filtration, continuing a requirement for masking, at least until we're well on the other side of this. These are probably critical measures that should remain in place. And importantly, they'll help us keep numbers down so that our economy can continue to function and our health system can continue to function. So keeping eyes on both sides of this. If you have cases running out of control, I think you compromise not only the health system, but the economy. The second is vaccines. So trust in vaccination. Ontario and in Canada in general is remarkably blessed in our access to vaccines, and people have embraced these vaccines. It was really nice to hear Dr. Wahi talk about kids. I have young children, and we're really excited for when they're going to be eligible. Ours are under 5, unfortunately, so we're still waiting. But trust in vaccines. These are really one of the true miracles of modern medical science and biotechnology. For all of us who practice in medicine, I think there's few examples that we've seen in our career of something that is this remarkably effective with such few side effects that has been developed this quickly. This really doesn't happen. So we're living in miraculous times, and I think everyone should acknowledge that when we talk about these vaccines. Yes, there are some differences between vaccines. Yes, some people will lose the effectiveness of protection over time, but let's not lose the forest for the trees here. These vaccines are remarkable by any measure. The third thing I'd say is, as we talk about cases, let's not forget about long COVID, as Dr. Wahi said. We recently did a review, and by the most conservative estimates, 10% of all infected people will have lingering symptoms beyond 12 weeks. So if you look at just Ontario, we're talking about probably at least 60 to 70,000 people in Ontario will have lingering symptoms. And importantly, this is not a disease of the elderly or people with severe underlying health conditions. Long COVID can affect very healthy, very young people and really be quite debilitating. Finally, I think in our communication, we should be really careful about not overpromising. So we get asked a lot about the government's predictions about loosening restrictions in the spring. Truthfully, nobody knows. No one anticipated the Alpha variant. No one anticipated the Delta variant. We're hearing about a scary new variant in South Africa now when cases have rapidly escalated. Who knows what's around the corner? And I think we need to be humble about that. Do what you can to protect yourself, do what you can to protect your community, and acknowledge that this may last for quite a bit longer. So I think that's what I would say for the pandemic. In terms of what we've learned about our health system and where we need to improve after the pandemic, a few things come to mind. The first is, I think for people who are researchers and care about health outcomes, we've cared about social determinants of health like income, occupation, ethnicity, for a long time. We've seen sharp gradients where the poorest marginalized groups have the worst health outcomes. COVID-19 really highlighted that in a way that I think is quite notable for the general public. We're really seeing very, very sharp differences between neighborhoods, between income groups, between occupation and who's getting sick and who's having severe outcomes from this disease. So I think recognizing the importance of social determinants and thinking about how we can address those. The second thing I think after the pandemic we need to care about is data. So Canada was once a leader in the integration of health data. We were able to capture statistics about our populations like very few people in the world, but that was decades ago. And in the decades that have passed, we've fallen significantly behind. And as this pandemic rolled through, we quickly realized we weren't able to figure out where the cases were occurring or who they were affecting or who was vaccinated. And this was a real problem in our ability to manage the pandemic. And this is something that we can learn from other countries, which were able to do it much better, places like the United Kingdom or Israel. The third thing I think all of us noted during this was the fragility of the health system. So prior to the pandemic, Canada already had one of the lowest number of hospital beds in the entire OECD. We had one of the lowest numbers of doctors per capita in the entire OECD. And we were always operating on a razor's edge. People talked about hallway medicine before the pandemic. Bad flu seasons would tip us over before the pandemic. I think this highlighted for everyone how precarious our situation is. We have very little excess capacity in the Canadian healthcare system, and it takes very little to tip us over. And you saw more than 3,000 patients acutely transferred from hospitals during the pandemic. That's really unprecedented in our history. The fourth thing I'd say is public health. We've underinvested in public health for many, many years, and you saw the critical role that public health has to play in a pandemic. That was visible, but the invisible deficiencies in public health have been lingering for many, many years. Our ability to vaccinate people, our ability to get public health campaigns up and running was very limited, and you saw the effect during the pandemic. And the final thing I'll say is virtual care. So, medicine is inherently conservative. I think a lot of us were resistant to virtual care prior to the pandemic. The experience has been that much of care can be delivered effectively through virtual means. Not all of it. Importantly, we need to distinguish what requires in-person assessment from virtual assessments. But we're an enormous country with a very small population, and virtual care is going to be part of our future.
Excellent. Thank you, Dr. Razak. That's a very important point that you make about the whole idea of social determinants of health and the public health narrative. And I think this is an excellent segue actually to bring in another all-star that we have here, Sabrina, who is currently a PhD student in public health and is an excellent knowledge translation expert as well, using unambiguous science and getting us information in a timely basis. I'll just quickly give you a short introduction about Sabrina before we ask a question to her. So Sabrina has an educational background in clinical pharmacology and toxicology. She previously worked in biotech as a medical advisor, and in 2016, she retired from her role in biotech and worked with her husband to co-create a foundation called the Sabina Vora Miller Foundation, which is a philanthropic endeavor with the goal of improving the health of people and the planet. And for Sabina, philanthropy has always been part of her sort of reason for doing things for the public and the community, and pairing it up with a healthy dose of science. As an immigrant and woman of color, she's amazed by the impact social capital has and wants to support organizations that are helping to build a more resilient and diverse Toronto for everyone. So Sabina, we're pleased to have you here. Thank you for joining us. And I guess the one question I have regarding this is, one, how do you see your role impacting this conversation about social determinants of health and public health? And I know you've done some work around preparing kids for child vaccinations. Could you tell us a little bit more about that?
Thank you so much for that really kind introduction, and thanks for having me here today. I would like to echo some of the points that Fahad just mentioned with respect to, what we've seen with how over the last decade or longer, in fact, we have not invested in the public health capacity here in Canada. Over time, we're seeing that the people who are left behind are generally people who are from marginalized and racialized communities. And we've seen that throughout the COVID pandemic, especially that the South Asian community has been disproportionately impacted. Once again, this was not something that occurred in March 2020. This has been something that has been occurring for several decades prior, and it's just been exacerbated and highlighted through this pandemic. And so the reason why we created our foundation was really to focus on making healthcare accessible and equitable for all Canadians, regardless of your background, who you are, what your education level, what you do for a living. The idea is to have equitable, inclusive access. And I think that's going to be exceptionally important for us as we look into what the road to recovery is going to be post-pandemic, and making sure we're not leaving anyone behind, and especially not leaving behind anyone from our own communities. That is, as a newcomer to Canada, something that's very, very important and something that I'm very passionate about. And of course, with respect to the vaccines with children, as a mom to unfortunately also a child who is under the ages of 5, I'm watching everyone getting their children vaccinated with so much joy. And vaccines are such an incredibly important tool in our arsenal to fight against COVID. I think that we are at a stage where parents have questions, parents have concerns, They want more information about the vaccines, and this is normal. This is natural. I think also, especially as parents, our job, our responsibility that comes with protecting our child, we all take this extremely seriously. And so, I would encourage anyone who has questions and concerns about these vaccinations to please speak with someone within your community, speak to a trusted healthcare professional, someone that you trust even within your community, your faith leader, anyone who you actually have that trust and relationship with. We're all here to answer your questions, and to do so in a judgment-free space. So really, actually, thank you to everyone here on this panel for making the space available for people. I also do want to, quickly talk about how very often I see within at least the South Asian community a distrust with healthcare systems, with government systems, and with good reason. I think that throughout the pandemic, our communities have not been prioritized with respect to making sure that people in our communities, especially the frontline workers, have been protected throughout COVID. I do get a lot of questions from our South Asian community asking me about, whether these vaccines should be trusted, whether this information should be trusted. And I think this is where we all play a really important role. And again, ask us if you have questions, if you have any concerns, we're here to address them. But I think that we have to be mindful of the fact that our community has already borne the brunt of the pandemic. And we have to make sure that when we exit, our exit strategy makes sure that we're not leaving a single person behind.
Amazing. Thank you, Sabrina. Thank you for those words and for your stories and for the light that you've shared with our community throughout the pandemic. I've been fortunate enough to follow you over social media, and I've seen all of the great advocacy work that you've been doing. So thank you so much for those words and for joining us. And of course, feel free to jump in on any of the live Q&A questions that are to come. First, before we get into the live questions, I did want to ask Dr. Sonja Anand if she could give us a little bit of an update. I know you've been working on some studies with the South Asian community, the COVID community study. So are you able to provide an overall update and in terms of what we know thus far about immune response in South Asians living in Canada?
Thank you very much, Sujani, for that question. And I would like to thank all the attendees today who may be participants in our COVID community study, as well as anyone from our research team who's here. Everybody pulled together in April after we were funded to do a study just within the South Asian community. And for many of the reasons raised earlier tonight, we knew that the Peel region was a hotspot. We knew that testing was lagging, and we were concerned about the high hospitalization rate of South Asians. And as a physician practicing within Hamilton, walking through my ICU, I would see a number of patients each week who had come from Brampton, and the beds were filled, the ICU was filled in Brampton, and they were sent to Hamilton. So that was incredibly difficult for them. They were in intensive care, their families were far from them, and it just was the tip of the iceberg for us to see that there must be such significant challenges within the community. So we all banded together and recruited very briskly, primarily from the Brampton Soccer Center, the Mass Vaccination Clinic, the Embassy Grand Testing and Vaccination Center. And so we have recruited 1,500 South Asian men and women from Ontario, and my colleague in British Columbia, Dr. Scott Lear, has surpassed 500 South Asians recruited from the Fraser Valley. So we have quite a robust population. I will just say for a moment that our South Asian community rallied and answered the call to participate in research. Sometimes we wonder, maybe there is mistrust or distrust of research, but I think having an all South Asian team predominantly there every single time, and Jay Neal was recruiting quite heavily, every single time we approached someone and invited them to participate, the majority of them said, we want to help our community. We want to learn more about COVID so that we can help the community. So we were overwhelmed by this response. And many of the comments this evening on the social determinants of health ring true in our study. So we're just analyzing our data now, soon to submit for publication, but we can see the huge impact of the types of employment our participants have, their difficulty taking time off work to get tested, and also the concern that they had without being tested of perhaps spreading COVID infection to their family members, given that oftentimes large families live together. And we did notice on our questionnaire that oftentimes our participants would prefer not to answer some of the questions, and we pondered that for a while, and we realize now it's likely due to the stigmatization that they had already felt about COVID-19 in this hotspot. So research is so important so that we can provide the data that supports future public health and government decisions, especially for this community. So the social determinants of health are not new. They always existed, but the pandemic shone a light on that fault line between communities who are privileged and have access and those who do not. And so again, I think all of us here tonight are sharing in the same beliefs that we need to protect the community. We know that vaccination is the best way to do it. And we've had an incredible response amongst the adults. Now the next challenge is for the younger children. Parents will be hesitant. We all are as parents whenever we take our children to a hospital or to a clinic. We're here to reassure you that the data from the United States with over 3 million children already vaccinated, you read the research papers in the New England Journal, you'll see next to no side effects, just the sore arm, the general feeling of being unwell for a day or two, but nothing serious. So like everyone here tonight, really strongly encouraging parents taking their children out to get vaccinated.
Great, thank you, Dr. Anand, for giving us an update on the study. I guess now we'll open the floor to the questions that we've been receiving actually in the chat already. There's some really good questions, so we'll just get right into it. And I guess what I'll do is I'll just bring up a question, and then anyone is feel free to answer that question. So the first question we have here is why does some vaccines like Pfizer's response to serious illness fall drastically with time? Does not our immunity have memory?
A good one for Zane.
Yeah, sure. So, number one, I really want to reemphasize here, across all age groups, there is still significant protection against serious disease from all ages, from the Pfizer, Moderna, Janssen, AstraZeneca, and mixed vaccine series. And in fact, that is the last thing that seems to fall. And this is being seen here. It's data I just reviewed from California and in places like the United Kingdom. Again, the burden of disease, particularly amongst unvaccinated individuals in terms of severity. We do know that, if antibodies do wane and people that are just generally, again, at higher risk of complications, if they do have a breakthrough infection, unfortunately, it does mean that their genetic makeups or their ages or the diseases they bring to the table, unfortunately, at the time of their COVID-19, may lead them to more complications. And this is where, it's not necessarily the vaccines not working. It is, the people over the age of 70, people with multiple medical issues, particularly over the age of 70, people with immunocompromising states where they may not make a great response to a vaccine, where they're at higher risk of complications at the time. But I do want to reemphasize this. We have vaccinated millions of people in Ontario. To this point, 11 months into this pandemic of this vaccine era during the pandemic, under the age of 60, there have been 9 people under the age of 60 who are fully vaccinated that have ended up in the intensive care unit. There have been 6 people that have died under the age of 60. That is of millions and millions of people under the age of 60 that have been vaccinated. And so those are profound numbers, and they may get lost in the shuffle of all of these boosters and the discussions around waning immunity, that many, many people still have incredible protection against severe disease as long as they get their full series of vaccines. Yes, we do need to worry about those who are older and have some compromise in terms of their long-term responses, and offer them the booster, which we're seeing is helping in certain situations. But the vast majority of the population has not lost their immunity, and no data series really is suggesting that they will lose that immunity right now, at least 8 to 9 months into this, to severe disease. And again, what we're hoping for with boosters is to protect those who are the most vulnerable. And as some countries are rolling them out to younger age groups, using them as a tool to maybe reduce transmission, although there's other issues at play there when we talk about that. So, again, if you're a under 60-year-old, you're right now fully vaccinated, your general risk of getting severely ill and ending up in the ICU is incredibly low outside of those groups that are being offered a third dose, like immunocompromised individuals.
Thank you, Dr. Chagla, for clarifying that. We're getting a lot of questions about the under 5 age group. So is there a plan around vaccines being available for children under 5? Maybe Gita or Sabrina can get us started, and if anyone else wants to comment, feel free.
Yeah, right now those under 5, the trial is underway and hopefully will be finished by the end of 2021 with rollout in early 2022. Sabrina, do you have anything else to add to that? Does that sound like the timeline you know?
Yeah, so I think Pfizer said that they should have the 2 to 5 data available by end of this year. Takes around 8 to 10 weeks for approval. So probably approval by around end of February, beginning March. And then the 6 months to 2, because it's done in a stepwise way, will be available after that. So we're expecting approval around May or June of next year for that age group.
Great, thank you for that information. We have another interesting question from one of the attendees, and they asked that my children already had COVID and had hardly any symptoms, light fever for 1 day. Do they need a vaccine? Can they get differently sick if they got it again?
Yeah, I mean, so the recommendation is yes, that even if you've had COVID, that you should be immunized and should be immunized once you've recovered and that you're out of isolation, because the response your body has to the actual infection is not as strong as what you would have with the vaccine. That's my non-ID immunology answer, Zane, unless you have anything else to add.
No, I mean, I think the other part, and I think Dr. Razak had mentioned it as well, is like, we don't know what the future is going to hold with this virus, right? We are talking about a new variant emerging in South Africa, in a place where, much of the protection in that area is from people that have had COVID, not necessarily have been vaccinated, right? And so, it takes a while to get fully vaccinated. And especially as we see variants, it's happened in South Africa and that region of the world twice now, that we see variants that might escape natural immunity a bit more. We don't want to be caught behind the 8 ball when we have a tool in the chest, and we have lots of good data, at least from the adult world, that the risk of reinfection, the risk of hospitalization is much lower in individuals that are vaccinated on top of having a natural immunity. In fact, they probably have the best immunity of people out there, that's so-called hybrid immunity. But again, we never want to be caught behind this virus. It changes every day, and we do need to make sure that people invest in the tools right now that have the ability to protect them. A vaccine in one system is working, and it's working all the time, no matter what happens to this virus in that sense.
Thank you. And we're getting questions quite pouring in, so hopefully we can get through all of them. Our next question comes from an attendee as well. Viruses have been present among us for a long time. For example, hepatitis. Hepatitis also kills people. Why is the government obsessed with COVID-19? It was never strict about immunization against other viruses like this.
That's a good one for Dr. Razak.
Yeah, I think that's perfect.
I'm happy to answer that. So I think for all of us who work in the healthcare system, you're right, there are other viruses that can make people quite sick. Many of those viruses, including hepatitis, are widely vaccinated against in the Canadian population, but they're not mandatory. And so the question is, what has made this a special situation, and why are people focusing on it so intensely? I think that all of us have not seen a condition which has affected this many people to this degree of illness in our careers. And if you look at the statistics, there's probably only been one other major example in human history where something like this occurred, which was immediately after World War I, when a form of influenza swept through the globe. The difference is they weren't able to protect their populations then, and the estimates suggest that more than 50 million people died from that influenza globally. We are in much more fortunate times now. So we have a disease which is extremely infectious, which can stress our healthcare system in a way that none of us have ever seen. So as I mentioned in my comments earlier, more than 3,000 people admitted to hospital had to be transferred, sometimes against their will, to other hospitals because of the stress on the hospital system during this pandemic. That doesn't occur with hepatitis or other infectious diseases. So this was fairly unique. The other factor is the economy. So all of you who are not in healthcare, the rest of my family don't work in healthcare. This has been among the most stressful 2-year period of their lives, as well as many parts of the economy shut down. There hasn't been another infectious illness which has swept through and shut down society this way in living memory for anyone as well. So for all those reasons, I think the emphasis on mandatory vaccination is very well placed. This is a safe vaccine. It's an extraordinarily protective vaccine. This is a disease which has stressed and then sometimes broken in some parts of the world the health system, and is placed a major and unprecedented strain on our economy and on our educational system for our children. And so having a vaccine that can get those other parts of our economy, our health system, our schools back and working and protect people and do so safely, it makes sense to me that we've placed the emphasis that we have and that we've made it mandatory in many circumstances.
Yeah, I would just like to echo Dr. Razak. I mean, this virus is more infectious and more lethal than the other conditions mentioned. And we haven't seen this, for almost a century. And one would only need to walk through your hospital's intensive care unit to just see the damage that the virus has caused. And perhaps sometimes I think when people who are outside the healthcare system have not seen that it is kind of, why is all this hype about the virus? Everything's been fine in my local circle. But if you see the otherwise previously healthy patients who are now on a ventilator or on, external oxygenation of their circulatory system, that's just enough to convince you. So this is more infectious, more lethal than anything we've seen in the last 100 years.
I was actually really curious to see how many people die worldwide with hepatitis. So I did a quick search, and on average, you see around 800,000 deaths due to hepatitis worldwide. And I looked up to see how many people we've lost due to COVID worldwide, and it's now over 5 million. And this is despite us having risk mitigation strategies in place in many of the countries worldwide. So it really tells you the differential in terms of really how devastating the disease can be for people.
Great, that's very thought-provoking stat over there. Next question is also very interesting and probably applies to all of you. So it says a lot of healthcare workers are not getting vaccinated, and that is not encouraging. They're willing to lose their job over it, and this is quite discouraging and sends a signal to the average non-medical person.
Can I offer a few
think
comments on that?
Yeah, sure. Go.
I'll just say that I think the media coverage of healthcare workers who have not been vaccinated has been disproportionate and gives the impression that it's common. It's not common. So if you look at our institution, Unity Health, which I think employs more than 50,000 people, we lost 1% of our workforce, 1% of our workforce, or to put it another way, which I think is more important, 99% of the people at our institution ended up getting vaccinated. And so I don't know a single healthcare worker personally who hasn't been vaccinated, and we all care about our health and our families as well. And so I think actually there's been an enormous vote of confidence from healthcare workers about how effective and safe these vaccines are.
Yeah, I was just going to add that same in Hamilton, we do have just a handful of healthcare workers who aren't vaccinated. So it's actually extremely rare. And, you know, the one or two cases you may know about, you think, well, perhaps there are many more healthcare workers who feel that way. I think that is not the experience that we've had locally. Zane, I think the same would go for you at St. Joe's. The vast majority are getting the vaccine.
Yeah, absolutely. And you know, the few that are not, there are many different reasons. But you know, even conversations has still helped convert some people over. So you know, it's still good. And sometimes it's family, sometimes it's friends, sometimes it's a trusted provider. But I'm still, you know, for patients and others, I'm still always, you know, asking and questioning and trying to be a trusted provider. And it's still surprising how many people are just had a few little barriers to vaccine that can be dealt with in a conversation. So for all of you out there that are fully vaccinated that know one of those healthcare workers, you know, have the conversation. It's still not the end of it's still not worth not being that trusted person in that person's life to really address the issue more than anything else.
Absolutely. Conversations are key. So flipping back to the kids, we've got another question. So is there any data from the United States or anywhere else on incidents of cardiomyopathy post-vaccination in children, specifically boys under 12?
Yeah, so we haven't, so of the 3 million children in the United States under 12 who got vaccinated, we haven't seen that signal. And the children that I saw who did have myocarditis were often boys over age 16. So they were the older boys. And I'd say most of those children resolved before they even got into hospital. It was really short-lived and had, you know, and recovered quickly from it. So we haven't seen that signal. And we don't expect to, because when we think of myocarditis in children, we often and more often see it in older children. We don't often see it in younger children. So it's not typically a condition in this age group at baseline. We also know that there's higher risk of getting myocarditis from the COVID infection than there is from the vaccine, even in that older age group. And then the other piece to consider is that in this younger age group, they're getting a third of the dose. So it is the third of the dose, and the 8-week interval between the two doses should decrease the risk if there is one, which we haven't seen yet.
Great. Okay, next up, there's a couple questions around some of the timelines for vaccinations. I'm just going to combine a few. The first one's asking, what is the earliest time after a COVID infection can the vaccine, the first dose or a booster, be taken? And is this dependent on age? And then the second one is like, after how long will a child who's double vaccinated considered fully protected?
So I believe the public health recommendations around when to get a COVID vaccine after an illness is once you've recovered from that illness and public health has told you that you no longer need to isolate. you're considered fully protected 2 weeks after your second dose. And then, when I think about reasons why the immunization may be delayed, the only one I know of that pertains to children is that condition I spoke about earlier, children who developed MIS-C or MIS-C after their COVID infection. The recommendation is that after that, they delay their immunization by 90 days or until they're completely resolved.
Thank you, Dr. Wahi. So our next question is a little bit of an ethical dilemma. And I'd like to pose this to the whole panel, actually. So I have an ethical dilemma with getting a booster shot when so much of the world has not even had their first shot. Are we not depriving them of critical care? Does anyone want to get us started?
Yeah, I'm happy to go first. I mean, I think I've been one very concerned about the global equity in vaccines, basically since we started vaccines. Look, there are certain ethical concerns about giving booster shots, and I 100% agree. I think a lot of younger people are being offered the vaccine, like healthcare workers are struggling with the same issue. We realize that the world, does need a supply of vaccinations, and we do have a lot on our soil, some of which are going to expire that likely do need to be given to Canadians, as there's not really an equitable or easy way to have them leave our soil and be delivered to another place without losing them in that sense. I think this is, for me, this is an area where, being data driven in terms of who is at highest risk and who we offer protection, that extra level of protection with the booster shot is entirely reasonable. And again, the elderly population, the immune compromised population, there even certain healthcare workers at high risk of exposure, do fit kind of that criteria of people at higher risk. But I think there is also considerations on the other side of the table about when we start getting into lower risk categories, younger individuals, what the benefit of a booster is, and particularly as we start bringing vaccines into Canada to meet that demand, where that is directly taking from the rest of the world. So yeah, absolutely, this is not a trivial issue. I think, again, if you're an elderly person and an immunocompromised person, please consider taking a booster. And again, they're offered for you for the sake of your own protection. Certainly there are ways to donate back if you do get your booster. There's a great campaign through UNICEF or Give a Vax and Get a Vax. So again, using that reflection of the time you get that booster shot to make sure that you can contribute to global equity. And I think similarly advocating for if you are one of those risk groups that gets a booster shot, advocating for global equity in vaccine, advocating for the COVAX system, and making sure that vaccines are supplied to the rest of the world, and recognizing that this is a privilege that many don't have access to, and focusing on being an advocate for global vaccination in that sense.
Yeah, I would just like to add to that. I think I'm in agreement that there are certain groups who should go and get the booster. We may learn that we expand that list somewhat as research evolves, but we don't need the entire population to have a booster shot in this scenario. Canada is part of COVAX, and we do donate our extra vaccines to that group that will then redistribute to other countries. I mean, we do, again, like we said, the COVID-19 pandemic shone a light on inequities. It shines a light on them once again, because all of us living in the global north are far more privileged than many people in low-income countries. Every time we get on an airplane, every time we fly to India, let's say, to visit our loved ones, we are the minority, the privileged who can fly back and forth. So we know that inequity exists. We can try and minimize it or reduce it. And I think I agree with Zane that in the case of the boosters, we have more vaccines than we need to cover our population adequately, and the extra vaccines should be given to the global distribution. And I really like the new programs where we can directly support the purchasing of those vaccines on an individual level.
Can I also quickly add on this that Zain and Sonia have definitely said everything that I also feel very strongly about. But I mean, I think that if you look at the numbers, less than 5% of the world globally has been fully vaccinated. And that's a travesty. It's a travesty that in some countries, healthcare workers and older people who are at high risk are not yet vaccinated. But, you know, I think that we're at a point to where we are able to help in other ways, and it does not necessitate someone who requires a booster to give up their booster right now. For instance, you know, we are receiving, I did a calculation last week, but we're going to be getting at minimum 55 million doses next year. And we have the opportunity to purchase even more than that. And that is a significant amount of vaccines that we're not going to use that we can actually give into COVAX. Canada, as Sonia was mentioning, was also contributing financially towards the COVAX AMC. But I think one of the ways that we can really advocate for global equity is to advocate for Canada to share intellectual property through the TRIPS waiver. I think these are some of the things that we can actively do as citizens of Canada. We can also advocate for making sure we're sharing technology and know-how with the world so that the world can manufacture and produce their own vaccines and their own medications. And you know, it's the saying about giving someone a fish versus teaching them how to fish. I think that's a really important distinction as well. So there's a lot that can be done to ensure that we are working towards global vaccine equity, which is incredibly important. But if you right now qualify for a booster, that's not going to make a dent. So please do get your booster if you qualify in Canada. It's for a really good reason that we are giving boosters here. So don't let this be a reason why you deny yourself a booster.
Great, thank you all for that very important discussion. Next question we have is, so if we are past 168 days from our second dose and yet ineligible for the booster, are we at higher risk, especially as people with health conditions?
So I would say, you know, again, if you're of the older age group, you know, and you're past that 168 days, if you're immunocompromised, people should have been done earlier, you know, without timing in place, or at least I think it's a 2-month lag. It's not a 6-month lag. You know, please access your boosters. As it said, you know, you still have significant effects from the 2 shots, but this is really to minimize the severity of people that do develop breakthrough infections in that context. And we've seen the dramatic effects even in long-term care, who are first people vaccinated, who we did, you know, provide a booster campaign, and real, you know, the burden of COVID in long-term care has been better than it ever has been during the pandemic. I'm not saying it's gone, but it's better than it has been during the pandemic. You know, this again goes back, if you pass day 168, and you know, many of us in healthcare have passed day 168 and then some, you know, it doesn't necessarily equate to my protection has worn off. There may be a slightly higher risk of breakthrough infections of people that develop mild COVID-related illnesses. But again, that severity is very, very preserved. That protection against severity is very preserved. And those figures, again, of 9 in the ICU and 6 that have died. Number one, you know, some of that may be people that may not have made a response to the vaccine, who have conditions that compromise their ability to make a response to the vaccine. But number two, a lot of that, you know, number is people that got vaccinated, healthcare workers, young healthcare workers that got vaccinated well back in December, January, and February. And so, again, even to this point, we have not seen that severity amongst those people who are 8, 9, 10 months out from their primary vaccine series. So again, if you're a 40-year-old that's reached day 168, there's no reason to panic. It's still important to practice, public health measures, avoid large crowds, make sure you're in well-ventilated settings, wear a well-fitted mask. But again, the risk of someone becoming seriously ill with COVID-19 and who's fully vaccinated in that age group is incredibly low. I have not seen anyone yet really who's fully vaccinated who's ended up in our hospital, with being under the age of 60 and not having a condition that would predispose them to vaccine failure.
Thank you. The next question we've seen a few times. It's about the frequency of booster doses. So will we have to take booster doses every year like the flu shot?
Dr. Razak.
I'm I'm happy to answer this, but we do have an infectious disease doctor on this call. So I will say that the expectation of many is that there'll be need for additional boosters. Those boosters could be repeated versions of existing vaccines, or they could be something that is tailored to the version that is circulating at that time. And with the variants that have come through so far, we've seen the more aggressive variants will almost completely displace the older variant that was previously in place. And so by next year, hopefully we're through this, but we may be in the presence of a variant that looks very little like the version of the virus that the vaccines were originally developed against. And so there's a possibility it could get tailored. I don't know if anyone would add anything to that.
Yeah, I mean, again, there's all bets are off. The reason we do influenza vaccines every year is because the virus changes so much in every year, and there's actually different species and subtypes that dominate and match to the specific vaccines. There's a lot of cool work being done with vaccines in COVID-19, and the 4 vaccines on the market are by no means going to be the last of them. There's lots of cool work being done on pan-coronavirus vaccines. There's lots of cool work being done on elements outside of the spike protein. There's lots of work being done on nasal vaccines to get as much sterilizing immunity in the nose where we think we get most of that. So, again, there is probably a need for different vaccines down the line. Many of our vaccine series that we have out there were not necessarily established to say there were 1, 2, 3 doses or what was the optimal dose, or then we're like the polio vaccine. It was a life-saving oral polio vaccine which is used around the world, but then development of an inactivated polio vaccine that was quite immunogenic and lost some of the side effects that we would see from the oral polio vaccine. So, again, vaccines are in development and the evolution of this is happening. This may not be the last vaccine people get, but I think there's a lot of hope, certainly, that there's going to be that the way we vaccinate and the way we approach this may be different as time goes on. It's not simply getting your Pfizer shot every year, in perpetuity.
And just a plug for the COVID community study, the second dried blood spot that we're collecting is to kind of monitor the antibody titers over time. So with more research, we'll understand for a given individual, when does the antibody titers start to wane? And is that waning associated with an increased risk of infection? So these studies are ongoing. There are lots of research studies ongoing. And for our COVID community participants, I know we bother you with emails and phone calls and send you kits to your home and ask you to complete them, but please do, because we're learning within our South Asian community a lot of important things that we'll be sharing with you.
Great. All right, well, next one we have is another ethical question, and it says, since last year I'm working in shelters where homeless people live. They don't take a single precaution. Few months I've even worked without a mask. I take public transit, going out for dinner, yet didn't get a single symptom. So why don't we have choice if I want to be vaccinated or not?
Zane, I think that one's for you.
Yeah, absolutely. So, I think, it is difficult, and there are populations where they are vulnerable, where their ability to get vaccinated due to other issues, mental health issues, are still there. It's important to know, shelters have dealt with significant outbreaks. There's been large, people that have gotten sick, and people in jails that have gotten sick. Is that that these are not necessarily benign institutions. And there is still a duty to protect those individuals too, even if they have other medical issues or mental health issues that make vaccinations difficult. They're people as well, and they can also suffer with COVID-19, and they have suffered with COVID-19 throughout this pandemic. And so there's been lots of people that have unfortunately lost their lives in the shelter system and the jail system. So again, I think we can do what we can as a society. We work together and we protect our vulnerable, and similarly, I think again, those who can get vaccinated to protect those who can't get vaccinated, whether they be the people too young to get vaccinated, the people that are compromised, the people that again have mental health issues or live in congregate facilities. It's our duty to protect them as much as we protect ourselves, and this is where vaccines are incredibly important for us, and again important for some of our younger members of society to offer some focused protection for those individuals as well.
Can I add one small comment to this? I think there's an element of luck in this, which what Zane said as well, which is that you're right, you could be exposed and not get sick, and we don't understand why any one individual will somehow not get sick and someone sitting next to them gets extremely sick. And when we use therapy, and this is not just about vaccines, this is when we use an antibiotic, this is when we give you a cholesterol medication to reduce your risk of heart disease. We never know who the individual is who's going to benefit. We just know on average that people will benefit. And in the case of vaccines, the average is extremely high. So the vast majority of people will benefit. And we give lots of other medications in medicine where it's not nearly as dramatic. I think people don't fixate on that because we weren't in the middle of a pandemic when we were treating your cholesterol level. It's just something that we did. There wasn't a lot of conversation. People took a medication and they moved on. And the amount of attention people placed on this has led to some difficult questions, like the one you're asking. But really, it's no different than so many of the other decisions we make in medicine. The second thing I'll say is that I've been a frontline physician in the hospitals through all the waves of the pandemic. And I've run our COVID wards at St. Michael's Hospital in Toronto during all three waves. And during one of the earliest waves, we admitted 20 people in the course of 3 days from one of our homeless shelters who were infected. And so you can have massive outbreaks in homeless shelters. And why it happened at the shelter that we were caring for and not the one that you were at, again, I think has a lot to do with luck and factors we don't understand.
Yeah, that's a great point. And I would just like to echo, I think that point plus Zane, you mentioned congregate settings. Recent study from the prison system in Quebec demonstrating that seropositivity is about 22%, so it's quite high when a large group of people live in close quarters. So, it certainly happened in Fahad's experience with the homeless shelter. It does happen in other congregate settings. So perhaps our individual asked the question has been lucky, and the groups of people he's worked with have been lucky. But we do see these outbreaks, and when they start, they're very difficult to kind of stop and put boundaries around because this virus is so infectious.
Anyone else want to chime in before we move to the next one?
You gotta increase the energy here, Janelle. We've got a few more minutes to go. And do you have some common themes coming out there? I wonder if people are asking about the upcoming Christmas holidays. What can you do? What can't you do? What should you do? What shouldn't you do? Can we get together? I guess maybe I'll ask that question to the panel. Can people have large gatherings of family members in their homes in December? What does everyone say? Zane, we'll start with you.
Yeah, I mean, look, this is a very different point than we were in December of 2020 when transmission was high and it was only getting higher. Healthcare resources were strapped and we had no vaccines. We lived a lot of this pandemic away from people, and you know, certainly I think we use vaccines as a bridge to get to that point to get back. Does it mean that we let our guards down and do absolutely everything that we want to? No, you can certainly, you know, keep gathering small. You know, we know that fully vaccinated people are going to have a lower risk of transmitting and bringing COVID to those gatherings. You know, in Ontario, at least our kids are being sent home with rapid tests, and that might be a nice way to also use a bit of testing to mitigate the spread, particularly amongst unvaccinated kids, you know, coming into those gatherings and even vulnerable adults. If again you're a vulnerable adult that's you know, offered a booster shot, it's a time to take it going into the holidays to reduce one's risk. But I think people do need to put, you know, that risk mitigation in place. Smaller gatherings, you know, good ventilation, like opening up the windows, and, you know, keeping things relatively reasonable, making sure you're not going when you're sick, and again, getting your vaccines and being fully vaccinated at the time, particularly for those populations that can get fully vaccinated by the time of that gathering, are all going to be important. But you know, there is room to do things small and carefully in this setting as compared to last year.
I think I'll also add to that, and you know, and what we've seen definitely in children and teenagers and in adults is that a consequence of this pandemic has been mental health, and so social connection is important, and doing it in a way that Zane just described, that's cautious, but you know, considering that social interaction and family connection is also something that's going to help us heal through this pandemic. So I hope people do it with caution, and I hope they get immunized, and I hope, you know, we can start reconnecting in person and not on Zoom as much anymore.
Thank you. And speaking,
Can I give a plug for Sabrina here?
Yes.
Can I just say, whenever I want answers to these questions, I go and look at what Zane and Sabrina are saying on social media, and I noticed that Sabrina has some flowcharts, which are very easy to use, where you say, where are you gathering, who's going to be there, and questions like this. And Sabrina, I don't know if you've produced one for the holidays yet. I think I saw one for the Jewish holidays, right, that are coming up.
Yeah, I just posted it today for all holidays, Hanukkah as well as Christmas, but it's just a decision flowchart, because I think everyone's at a point where we're all fatigued by making these decisions, and sometimes just having it out there outlined for you just makes it so much easier, and it takes the burden off of families as well to have to make some of these tough decisions. But yes, I do have one. I haven't posted on my website yet. I will do it after this panel tonight. But I do have a decision flowchart to sort of help families through that. But it really just echoes everything Zane talked about with respect to, you know, making sure that you're trying to take some mitigation measures in place to reduce risks. You know, that's improving your ventilation. If you have access to rapid tests, which I know is a bit of a challenge to get a hold of here in Ontario, but if you have access to rapid tests, that's another tool in our arsenal that we can use. And of course, vaccinations, you know, make sure that everyone is fully vaccinated. If you qualify for boosters, get it 2 weeks before you gather to make sure that you have full immunity. And also just a reminder that with children in 5 to 11, they are probably only going to be heading into the holiday season with 1 dose and not 2 doses of their vaccinations. So again, it's really important for them to get vaccinated, not just with COVID-19, so at least they have some protection, but also get your influenza vaccine before you meet for your Christmas gathering is also another recommendation.
Amazing. And thank you, Fahad, for bringing up the decision flowchart. I also have seen those, and I was just going to bring that up too. So Thank you for bringing that up. We have time for one more question before we go into closing remarks. So Sabrina, you had just mentioned around, most kids will just have one dose heading into the holidays. We do have a question specifically about that. And that is, how much protection does one dose of a vaccine provide for a child?
I wish I had an answer to this question because I have been getting this question quite a bit. So with the Pfizer clinical trials, every participant in the trial essentially got their second dose 3 weeks after the first dose. So we don't really have data to quantify really how much protection they would have 2 weeks after their first dose. But I can tell you that it is more protection than they would have if they had 0 doses. So definitely have some protection. It's not, we just don't know how much at this point. But I would also pass this on to Zain and Gita to see if perhaps they have more thoughts on how much that one dose could offer.
Yeah, I mean, if you look at, we're now dealing with Delta. Everything is Delta now in Ontario and Canada. And if you look at least the adult data for a single dose of vaccine, we see about 30 to 40% protection against symptomatic COVID-19 with a single dose and about 80% protection from hospitalization. So, there's nothing, again, to poo-poo about there. Getting the second dose kind of solidifies the immune system and makes a longer and more robust response. But even getting that first dose into a child before going into that Christmas season is still going to be very important and may mitigate some transmission, as well as making sure that child doesn't get as sick if they do acquire COVID-19, whatever way that may occur.
Excellent. Okay. Before I invite Sabrina to do the closing remarks, I just pulled up the flow chart that we've been talking about here. I'll just quickly show you guys. That'll make it easier. Here we go. If everyone can see my screen. No. Okay, never mind. I'm not sure why it's not working. Okay, Sabrina, maybe you can do the closing remarks while I work on that.
Okay, sure. All right. First of all, I just want to say what an exceptional panel we've had today. I actually just absolutely loved all of the discussions we've had. So I do want to really start by saying thank you to Drs. Wahi, Razak, Chagla, and Dr. Anand. I think that our discussions today have been so rich and wholesome, and it's been fantastic. I do also want to talk about vaccinations being such an important tool in our fight against COVID. One of the fallacies we've heard in Canada is that COVID-19 is not a big deal in children. However, that's not entirely accurate. While the impact of COVID tends to be less severe with adults, we still are seeing a high number of cases in children. So since schools have reopened here in Ontario, we also know that there is a small but very real risk of serious conditions such as MIS-C and long COVID that we heard about earlier today as well. In fact, the burden of illness is higher than what we see for other diseases that we routinely vaccinate in childhood for, such as rubella, meningococcal disease, and other diseases. Importantly, we do not know which child might be severely impacted by COVID. 1/3 of children who are hospitalized for COVID, in fact, do not have any sort of underlying conditions or risk factors. And there are, of course, other benefits of vaccinations, such as uninterrupted education, seeing friends, hugging grandparents, getting back to doing the things that they love and miss, such as extracurricular activities. And on an interview I did earlier today, there was a child who said that she was really excited to get back to slumber parties and sleepovers. So these are all things that children can look forward to. But it's always important to weigh these decisions in the context of a risk-benefit analysis. And we now have incredible data that shows the benefits of vaccinating children far outweigh the risks. I know many parents still have questions and concerns, and that's completely understandable. And as I mentioned earlier, I am also a parent to a little one, and I know that we all take this responsibility of keeping our children safe very seriously. So again, if you have any questions, if you have any concerns, reach out to someone that you trust to speak to them and have your questions and concerns addressed on a one-on-one level. And lastly, as we talk about boosters and gearing towards getting back to some form of normalcy, we can't forget about the importance of equity, whether this is on access to global vaccines and medications, or even closer to home as we build on this next phase of an equitable, inclusive, and sustainable pandemic recovery. And for this, we need to build on strong and rich community partnerships. As the co-founder of the South Asian Health Network, I am especially grateful for these beautiful and wholesome partnerships and relationships that have allowed all of us to gather here today and have this meaningful discussion. It truly highlights that we are in this together and that we're powerful when we work together and in collaboration with our communities. Nothing for us without us. So thank you so much for joining us this evening. And with that, I will pass it back on to Janiel and Sujani.
Thank you so much, Sabrina, for those words and for reiterating the power of partnerships and collaborations and having conversations and dialogue. And we hope that we've been able to answer many of your questions today with our panel of experts. There are some questions that are outstanding that we weren't able to get to because of time, but we will try to find a way through the COVID community study to address those and get back to you with some answers. So I see Janiel has figured out how to share the screen. So here we've got the holiday decision flowchart.
Sabrina, if you want to walk us through really quickly, that would be great.
Sure. Okay, so at the top of the chart is if you have any sort of symptoms of a cold or have a direct known exposure to COVID-19 and you're waiting to get a test response back, then the best thing to do for these holidays is to stay home. But if you have no symptoms of a cold, you didn't have a direct exposure, then it takes you through whether everyone's vaccinated. If everyone is vaccinated, then is there anyone in your house who's immunocompromised or has high risk factors or is over the age of 65 who's not 2 weeks post a booster? If that's not you, then take a rapid test in the morning of your get together and your gathering and enjoy the holidays if it's negative. If people in your house are not fully vaccinated, recommend doing a rapid test again on the day of. If anyone is positive, stay home. If you're negative, a recommendation would be either to eat outdoors. If you cannot eat outdoors because it might be cold by December 25th, then be cautious, improve ventilations. You have options of opening your windows, adding HEPA filters as well. There are a lot of people who are now trying to come up with these crafty air filters and air purifiers that you can make at home for a fraction of a cost as well. And then the last bucket would be if there's anyone who is immunocompromised or has high risk factors. Again, it takes you to the same flow chart. If you can eat outdoors, that's fantastic. And if not, then again, be cautious as well and take measures to reduce your risks.
That's terrific. Well, that's great. We should get that put on a t-shirt and wear it for the holidays. But thank you so much for sharing that. Thank you to all our panelists. A big thank you to Sujani and Janiel. They're both busy, but they always answer the call. And we really appreciate all the time that everybody here tonight has spent. And I'll give a big thanks to all our participants in research and all our research team members who work hard each and every day to make all of the things we do a success. So thanks again, everybody. And we'll look forward to a future town hall. Not that I'm looking forward for this pandemic to continue too long, but there may be new issues to talk about, and we look forward to coming back together. So thank you again. Good night.